I'm Mohan HL. I'm CEO of KHPT. Lot of things happening. If you take last one decade, there are a lot of initiation. The people are political will. The people are highly visionary, bringing the TB in the forefront. There are a lot of campaigns, there are a lot of involvement of different sectors. All these are happening, I think, in a very, very positive direction. And recently, I can say, a year back, it is also a Jana Andolan, is conceptualized at the Government of India level and launched. We are all part of it now. The civil society organizations are taking keen interest in different, whether it is a preventive or the promotive care. So there are few gaps as well. What can be done to end TB as early as possible? Again, I'm talking about people's participation. There is available space and the structure at the lowest level, in the grassroots level, even in the urban level, is the panchayat and urban local bodies. The involvement of these elected representatives will enhance. Number two, you take the participation of the civil society organization in this kind of a campaign is very much required, because they have a connect with the people at the local level, and also the preventive and promotive aspect. I know government has a complete infrastructure of the curative, but the preventive and the promotive is always a challenge. Involvement of them will give a positive result. The third one, interestingly, the things are changing each day at the ground level. Take an example of metro urbanization. We need to redefine some of our vulnerable target groups. There's a lot of migration happening. It is our own experience. We have seen many slums are not vulnerable, but there are many other kind of situations worse than slum where the people are living. Not in Jopdi, but in a constructed house, but highly populated way. Now we need to redefine which are those localities, which are those people. And we need to very much focus into a different vulnerable group. That is another need of the hour. Public and private partnership is a must. This is happening from almost more than 1.5 decade. We are working closely with the private sector. And in our own example, we worked a project called JEET, where we are involved all the private practitioners and the private hospitals to increase the case notification. That really yielded a very good result. Saying that, there's a lot of things we need to do. We need to understand the ground reality. The people have three set of people are there. The people who goes to private, they don't turn and look at the public health. And there are people who go to public. They have a trust, they go, they're accessible and also affordable. All that comes in there, and they go there. And also there are people, don't go either here or there, because due to negligence, because unaware, because of the gender issue, because she's a woman, so many issues are there, and also they might lose a day's job. But we need to understand all the three category of people if you want to have a better and good partnership. Then what happens? Then we will be very clearly focusing where actually people left over. That's why if you want to increase the participation of the both working together with the private sector, I think understanding of the reality and the community and the population level is something important. KHPT is trying to create solution for this specific vulnerable group in 4 states, in Assam, Bihar, and Telangana and Karnataka. The whole idea behind that, you create in a behavioral change solutions that how this community's vulnerable group can be addressed. So this test it, and also government will scale up in across the country. I think that is where KHPT is contributing. So as I told, redefining this target group, their vulnerability, especially now migrant workers. You take any metro cities, there is a huge number people traveling across the state for their livelihood need to be reached out, either in their working place or their residence. So we don't know. Earlier it was very defined. Slums are people where the laborer used to stay. Now that is not the case. So we need to remap it, which we had done extensively in all these states, and we are already moving on the solution levers, and that will contribute in a huge way to reach out this population. KHPT, initially we are working in the HIV, and almost more than a decade we worked on, and we have seen that new infection rate is coming down, and we transitioned that entire program into government. But interestingly, when we are transitioning to government, we transition to the sex workers groups themselves, so they still continue to work. We have seen the big reduction in the infection rate. So in that line, we also started, you know that how the public health works. When we are working with the sex workers, we also had a very good understanding of the migrant sex worker. So we started with migrant population. We started working with the children of sex workers, how we entered into an adolescent health. So we also started many of the verticals days to come. When it comes to maternal and child health, we started reaching the vulnerable women. We worked almost more than 6-7 years in the northern Karnataka, Hyderabad, Karnataka region. So that model, what innovation it is reached out, so that is scaled up. We helped Uttar Pradesh government to map the entire state. So again, few districts were selected, and the entire model now scaled up in Uttar Pradesh for the maternal and child health. WHO came out with the kangaroo mother care as in a lab in the northern Karnataka. Later that also with the evidence scaled up across the Karnataka. So we worked on the different. If you ask me what is our reach, at present we work, except 5 states, we work in all entire country on the nutritional aspect. Very intensively we work in 4 states. KHPT has a clear mandate for next 5 years. We are focusing on 4 thematic areas: the TB, adolescent health, comprehensive primary health care, and also maternal and child health. Our vision is clear, what we need to reach and how many of them we need to reach, which geography we need to reach. So we are here to complement and contribute for the larger public health domain. And KHPT is doing that and will continue to do. So we are happy to note you that many of the innovation and model scaled up by the government across the country, and also few of the African and other countries as well.